these numbers. I think we're also going to get the newly crowned communications director down at Adelup, Crystal Pacos and Augustine. Is she coming on?
I think Jason sent her the link.
Okay.
Right? Yeah.
So I'm just not sure if we want to get her on real quick.
She's on her way down to, she'll be heading down to the vaccination clinic in Iran, the second one that they're standing up.
I got a message from a friend who's down in Iran. Made it to Iran 15 minutes ago. Got my numbered placard at 60 out of the 200 doses for today.
Ooh,
this is a vast improvement than yesterday's method at Ukudu. Can't tell how many drivers are behind me as I'm at an uphill angle, and I was told to stay in the vehicle. Good luck.
Number 60. It's only okay. So it's 8 o'clock, and I think it doesn't start till 9. So
yeah. They need to cut off drivers once daily allocation is met and communicate. Communicate, caps lock.
Well, you know, when we had Tyler Metanani was actually covering the Ukudu vaccination center yesterday, she was saying that when she was heading up there just maybe about 8:40 or so, that it seemed like the line was going out from the entrance to Ukudu, you know, that turn into the school. It was approaching GRMC. And then my mom, who is a teacher and she's making preparations to head back to face-to-face learning, she went out, I believe, about like 10:30, and she said that it looked like the line almost went from the Ukudu place almost to the fire and police stations. Right. And that was yesterday about 10:30 and everything. So a lot of people were making it out.
And I think when Tyler went back around 12 noon, or around that time, the line was already by Micronesia Mall.
Mm-hmm. Were they doing it in phases yesterday? Was it healthcare responders in the morning?
Yes. And then they had the Mononco in the afternoon, which
same thing today.
Yeah, and I think it's
but they're giving numbers.
It's definitely good news, today, right? That they're going to start having it at the clinics as early as Monday, and also that they've opened up the Enron Public Health Center, because there's a lot of Mononco down south, and make them go all the way up to Ukudu. And then wait even longer. So it's definitely interesting. There was a lot of criticism with the vaccination effort, but I'd like to see how public health is kind of pivoting. It's almost like OJT, you know what I mean? They've never done a vaccination at this level ever before, and I know you guys know that. So it's 8 o'clock. We're KUAM FM and Agotni, Guam. To our viewers on KUAM TV, thank you so much for jamming with us on this Friday. Whoa, business! My name's Chris.
Sabrina.
Esta. Adios.
Bye.
And we're back. Thank you. It's 8 o'clock. Friday, January 8th, the year of our Lord 2021. Let's go into the KUA News Zoom room. So we're just going to go with Dr. Lombard, and then we'll get Crystal on when she comes. Good morning, Doc.
Oops, unmute.
Unmute. Think you would know by now.
Sorry, guys.
That's all right. Happy New Year.
Happy New Year. Welcome back.
Thank you. Wow, so you got fewer numbers to crunch.
Yeah, we're getting back into some of that boring time over the summer where we didn't have many cases and things weren't that exciting, which is good for us. But I think we all recognize it could bounce back up at any time.
Right. Those 21 positives, that really stuck out to me when I saw that, because we had, I think, 13, and it was about 17, 21, and I was like...
Yeah. Hard to know how much of that is just reporting delays or if those all came on the same day. It's kind of strange to see, 5 or less cases on one day, and then the next day it's 4 times that much, and you don't typically see that big of a jump. But again, we got small numbers, so this is what we call noise in the data.
Right. So let me ask you, we had Dr. Ann on just a minute ago, and they were talking about the more in detail reporting of COVID-19 data that they're putting out. We're not getting it every day, but so I know you love this stuff. What's your take on that? Are we getting good info out of public health finally?
Well, it hasn't. I've been missing the weekly. They used to do a weekly age breakdown, and I found that report very useful. They used to publish that on Friday. I wouldn't be surprised if they do it today, but so I haven't really been able to look at how the ages of the cases have broken out. And again, now it's not as critical, but knowing the ages was very important to sort of try to predict the number of deaths we might be seeing in a few weeks. And now. Again, with the low numbers, our deaths should be just onesie twosies here and there, which is great for us. So just from that standpoint, again, what they're giving us every day is I think adequate for what we need to be seeing. if things start changing or moving in the wrong direction, then I think we'll all be wanting to pay more attention to the numbers and try to get into the details of those a bit more.
How was your vaccine?
Second.
Oh, I got it froze. Yeah. I saw you got vaccinated, Doc.
Yeah, I got my second vaccine dose yesterday, and you'd think that'd be the most the thing that would impress on me the most over the course of yesterday's events, but certain events in DC overshadowed, I think, even that. So,
Yeah, how do you think I feel? It's my first day back at work.
man, I mean, it was hard to not keep my eyes on the news or Twitter. Just incredible events unfolding. But yeah, I did get my second dose yesterday. A number of my staff went up there. Arms pretty sore. I took a couple Tylenol before bed, and I felt fine. I feel fine. A little arm soreness, and like I said, it's a really an incredible feeling. I wonder if people that were vaccinated against smallpox felt the same way at the time. To feel like I've got my 2 doses now. My body's ramping up the antibodies, and for all intents, I'm very much more protected than I was a month ago, and it feels really good.
Man, one of the things that I really noticed watching the events unfold in the nation's capital yesterday was all the no mask using, and that's kind of like my eyes now are just so used to seeing people wearing the mask that even when I watch movies now, I'm like, God, they're not even wearing masks. Look how close they are. They're not in the same household.
Mm-hmm.
Yeah, even when they evacuated the congressmen and they had to contain them in a safe area, from what I hear, there's still some of them that were refusing to wear masks, even as they're being evacuated from these protesters or what you will. So it's pretty remarkable. You got a lot of smart people who think they really understand the data, and they're coming to these conclusions, which are very, very different from what I feel like a lot more people that are more qualified to be able to look at the data and make better recommendations. It's mind-boggling, and it's really hard to wrap your head around.
It's mind-boggling that it's happening here on Guam. You guys saw that Payless video with that lady who was just refusing to wear the mask. I'm not Karen, girl. You are Karen. Yes, you are. I mean, it's really simple. I don't get it. I really don't get it. But anyway, back to COVID. Yeah. Doc, so what are you tracking with the numbers? You got any charts, slides?
Yeah, I got a few slides for you today. Not too much, but if Jason wants to close up, we can just go over those. I've got just a quick update to compare Guam to the rest of the world. Are you seeing this now?
Oh, let me just break in here. I got a message. 8 a.m. in Iran has met capacity. Someone was turned away just now. So.
No, it's from one of your friends?
Yeah.
Okay.
Wow.
Whew, that's how many were available?
Yeah, thanks for giving those announcements. Yesterday up at Okudu was just insane. I mean, I just couldn't believe how. I mean, they said 150 cars. I think it was 400 or 500 cars backed up all the way to the mall. It was
both ways.
I feel really bad for the people out there.
Right. It was backed up to the new flea market in Derrida, and then also I think almost down to like a little bit before the St. John's area.
Yeah. Well, you got my slides up, so you can see where we were and where we are now. We're now the best in the country. Hawaii's seeing a little bit of an uptick. I really hope that they can hold off until they can get more of their folks vaccinated. They have not seen a significant surge. They're really just in a fantastic position, and they have been the whole time. Interesting also with probably a little bit more lax of a quarantine requirement than Guam. But you can see the rest of the states just, they're now at the levels that we were seeing a couple months ago. Just to, again, put in perspective what we're dealing with, over 350,000 deaths in the U.S. and almost 2 million in the world. You just can't even wrap your head around it. And in the U.S. now, 3,500 deaths in a single day. We really, when you hit 1,000 deaths a day, you're like, wow, that's crazy. Now it's almost getting close to 4,000. It's just insane. I can't even really understand that. Guam vaccinations, I know you guys discussed this, and I think you guys are well aware. We're doing pretty well compared to the rest of the U.S. Saipan, if you hadn't heard, is probably even twice as good as Guam right now in terms of percent of the population vaccinated. They're leading the country very easily in terms of how well they're rolling out the vaccine, which is fantastic news. So, these numbers were were before yesterday's vaccination, so I'm sure they're higher now. But about 5,500 vaccines given over 3 weeks. To compare that to about 7,400 confirmed COVID cases that we've diagnosed. We're over 3%, probably inching closer to 4% of the population. At this rate, if we don't somehow speed things up, and it was nice to hear Dr. Nguyen on earlier and talk about the different the rollout plans to get these out to the clinics, we're not going to hit 30% until for 6 months if we stay at the same rate. So obviously, what they have set up, while it works really well, it's not, it doesn't, we're not going to vaccinate enough people fast enough to get to the herd immunity level. Even if we are at 25 to 30% exposed with the natural wild type COVID, we still need to get to at least 30% vaccinated, I think, before we're going to feel that herd immunity effect. Over 16 million people have been vaccinated in the world, which is fantastic. And of those, if you take out the numbers from China and Russia, which don't use the RNA vaccine, there's still over 10 million folks that have been vaccinated with the mRNA, which is, good news, and hopefully gives some people confidence that are a little bit hesitant to get the vaccine. In the US, 5.8 million on all of these have been with the mRNA vaccine. So this report came out just a couple of days ago. They have done an analysis of at least the first 2 weeks of the Pfizer vaccinations, and which is almost 2 million doses given, and the rate of anaphylaxis, which you guys know is a severe allergic reaction, was about 11 out of every million doses. Okay, this was just updated this morning, where they actually were able to combine both Pfizer and Moderna, and that rate went down. So 5.5 cases of severe anaphylaxis per million injections. I really hope that helps some people, at least for the immediate allergy threat. Hopefully that gives them some confidence to move forward and get the vaccine. It doesn't say anything about the long-term effects. Again, we have at least 6-month data for some of the folks that were in the trials, and even longer for folks that have been in clinical trials for other mRNA vaccines from 5 years ago. So the rate of anaphylaxis is 0.001%. It is a little more than the flu shot, which you can see is quite a bit lower even. But when you look at the risk of anaphylaxis from food, penicillin, contrast media, which is like iodine, latex or bee stings, these are 700 times more likely to happen from those things. Again, just perspective. Again, just trying to say, hey, what are the real risks here, at least in the immediate post-vaccination period.
Thank you
and
for that.
All of the cases have been treated too. So
very, very good to hear that.
Yeah. The mutations, I know you guys have been discussing this as well. I don't have a whole lot more to add. We definitely are seeing more transmission. Initially, the increased transmission was only seen in the UK, but now I think you can look at, I think Denmark for sure, and also Switzerland. They are seeing increased transmissibility for this variant, this B117 variant. So I think it's a very real thing, but thankfully so far the severity has not increased. But the real importance here is as this variant becomes more prevalent in the world, you have to mitigate even more to limit the slope of your cases. So if we continue to do what we're doing, and all of a sudden you introduce the variant to Guam, it's probably not enough, and our cases will start to rise again. Will it rise to the same extent as the last surge that we had? Quite possibly, if we don't make additional changes. So it is good news that it is very likely the vaccines will still be effective. I think when you look at the mutations on the spike protein, there are many different sites where the vaccine can attack. So or can generate antibodies to fight off the COVID, even with these variants. But how long is it going to take before enough mutations develop that eventually that the vaccines are less effective? So I think the real key point here for me is the vaccine mutates when it replicates. The virus mutates when it replicates. So the more virus that's out there and the more times it's replicating, the higher chance that eventually it will accumulate enough mutations that it'll render the vaccine less effective. and or cause even more transmissibility or even worse severity of infection. So we really need to suppress the virus as much as we can in as many places as possible, as fast as we can. Given the overall morbidity that we've seen so far and this threat of future mutations, it's really hard for me to understand why not everybody will want to get vaccinated as soon as it's physically possible. And I just wanted to mention yesterday, if you didn't notice, the JIC report, out of the 8 positive tests, 6 were identified in quarantine, if nobody caught that yesterday. So that's pretty interesting. I mean, I think that's going to be something that we'll want to track a little bit more closely out of the data, how many of these positive tests are coming out of quarantine. I do feel like we can probably transition, hopefully, to allowing residents to quarantine at home if we have controls in place. But it would be, if we do import this strain, I think that would really change the outlook for at least the next 2 or 3 months. We're still doing great in the U.S. Everybody's red except for Guam and the Virgin Islands, and hospitalizations is the best news here. In red, you can see us trailing down to the lowest levels we've had since August, and we're certainly lower than we were even in the first surge or wave in terms of hospitalizations. And our case positivity rate in yellow there has been pretty flat. It'd be great to see if we can keep these daily cases, the 7-day moving average, under 10. That would be just fantastic. But it's scary to see what's happening in the States, as others have said. There's rationing of oxygen. There's rationing of paramedics picking up and bringing people to the hospital because they're running out of space. And with this new variant, there's really no, and with the slow vaccine rollout, there's really no end in sight to that. Right. So again, we're very fortunate to be where we are, and let's hope we can stay here.
Amen.
Even with our own problems with vaccine rollout and the mitigation that we have to efforts that we have to still sort of struggle with and suffer through. We are in a much better position than a lot of other places in the world.
Doc, just going back to the variant, if we could, real quick, when they're because I've read a couple of articles where they're saying it's like 70% more infectious than the current COVID strain, and we thought the current one was infectious. I mean, how do you get 70% more infectious? And have you read anything about what that means in plain English? The new ways you can catch it?
Well, it's more about how well the virus, using its spike protein, which covers the surface of the capsule of the virus, the mutations are in a binding region where it binds to your respiratory cells. So it's much more easy for that virus to latch onto your cells and then enter your cells because of these small point mutations in the spike protein, and that's what makes it more transmissible. So perhaps a smaller dose from somebody that you're exposed to, it takes a smaller dose for you to be infected. I think that's one way to look at it. Your exposure doesn't have to be quite as robust. You don't have to be around somebody as closely for quite as long. I think that's one way to try to explain that increased transmissibility. 70% is probably on the high side, but yeah, the numbers are certainly showing 30 to 70% in that range, and we'll know more as time goes on.
Always appreciate your slideshow, Doc.
Yeah, that's it for today. So
that's it, kids. That's it. You remember that time when Dr. Cabrera was doing a slideshow and he popped up a picture of him meditating in the water?
In the water.
I'm surprised that hasn't happened with you yet. Right on, Doc. Okay. Anything in closing you want to throw out? You're very reasonable, Doc, and that's why I like to get you on. So let me just ask you in closing, from now, and I asked Dr. Rand the same question, from now to herd immunity, I mean, you're tracking 6 months, right, until we reach 30% vaccination. So what do we have to do to avoid the third surge?
Well, I think that 30% is based on our current vaccination rates, and I'm sure it's going to increase, especially when we get more companies that have their vaccines around. So I think realistically, maybe we could say we could cut that in half to get to 30% vaccinated. And then, I think that portends the risk of a third surge would be, if that third surge comes, it won't be as severe. The more people we can get vaccinated before that third surge happens. And all of that sort of can be thrown out the window if the variant gets here, because if we still have 50% of the population, for example, that are still susceptible, it's going to be much easier for that virus to reach that 50%. So, so this new strain that's out there, and any new strains that might be out there, I think it's really a global effort to try to eliminate as many people carrying this virus around as possible. So we'll see. I hope that more people will put their hand up to get the vaccine, because it's as sad as it is to see those lines of cars, it's really wonderful to see that many people really motivated to get protected.
Right on. There you go. Last word from Dr. Peter Lombard, who's been a fixture here on the link way back when it was called Containing COVID, Doc. And thank you for your service. I think you provide a very rational and a very crucial voice that's coming from outside of the government, that's coming from outside of these circles where decisions are being made. And I think that's why we really value having you on. So appreciate that.
Thanks, Chris. Thanks, Grant. Again, just disclaimer, I'm not an epidemiologist. I don't have access to the real data out there. Just I'm trying to put things together in the best way I can. And the caveat's always, this is none of this is official, just a lot of my own interpretation. But thanks again for letting me have a voice here.
Of course. Well, we did have a real epidemiologist on right before you, and you guys were kind of saying the same thing. So don't beat yourself up over it. Okay. Okay. Have a good weekend, Doc.
Thanks.
There you go. Dr. Peter Lombard, 820. We'll just keep it going in the KUAM News Zoom room as